everybody, and welcome to our segment today. We're calling it Roasting by the Fire, which is a very topical name because, as you know, physicians in Ontario right now are currently being roasted by our Liberal government, and that's what we're here to talk about. My name's Dr. Michael Savatteri. I'm a family physician in Stoney Creek, and this is my close friend and partner, Dr. Jason Profetto, who's also a family physician here in Stoney Creek.
Thanks for having us, and Mike, I love the sort of visual pun with roasting by the fire, and fortunately we don't actually have the heat on this, so it's going to be more of a visual effect than an actual thermal effect, right?
Yeah.
So, and I mean, I'm happy to chat. There's a lot of things going on right now in the government and things to talk about, so I'm happy to get it started as soon as you are.
Okay, why don't you just go ahead and tell me bring us up to date. What's been happening in Ontario this last year or two with respect to the Ministry of Health's decision to make cuts?
Yeah, that's actually a great starting point. So I think we'll make it very simple and straightforward. There have been a lack of negotiating between the provincial Liberal government and the Ontario doctors represented by the Ontario Medical Association. Unfortunately, over the last couple of years, there's been no actual contract between the Ontario doctors and the Liberal government. As a result, there have been actions on behalf of the Liberal government and Dr. Eric Hoskins, who's there, the Minister of Health, and they've been actions in a very unilateral way, meaning that they have done things, and specifically they've made cuts. They've made multiple cuts starting in February of this year, 2015, that have affected physician services and the things that we can provide to patients. Most recently, and I think what's probably started the most, if we can call it outrage and anger by Ontario doctors, is the recent 1.3% just in the last little while. So what we're seeing is that there's been a sequence of multiple cuts, and it's been an effort on the provincial Liberal government to balance their budget. And the one last thing I'll say here is that I think what's happening is the Liberals are trying to actually balance a budget while picking from patient services, and there's a lot of smoke and mirror going on, actually misleading people what the actual issues are.
Can you give me some examples of those misleading statements or directions that the government is sort of spewing to the public?
Absolutely. I mean, so that's a great question. There's a few directions we can go. I'll choose one example to give you. There are actual cuts. There's unilateral cuts being made to physician services, so things that we're actually doing for patients. And how it's getting spun is the actual platform on which it's being delivered. So cuts are being made, and then when questions are asked, there is this fallacious attempt to redirect the attention to other issues. Mm-hmm. So although cuts are being made to physician services, the Liberal government's responding by saying, yeah, but look at what doctors are making. Mm-hmm. Whereas the salary of a physician or compensation is not the problem.
Right.
They're making it seem like the problem, but what's really the problem is an unsustainable healthcare system that needs reform, that needs to have more efficient things put into place, but in a much more collegial way with the government and on the Ontario doctors.
Yeah. You say a lot of important points there. I think that summarizes very nicely a lot of our sentiment about what's been going on. Do you think these cuts will, I mean, we know they will harm physicians and they will potentially drive physicians out of the province. Do you think these cuts will harm patients?
Yeah, so there's a couple of awesome points there that you bring up, right? I think to directly answer your question, I think there is absolutely, unequivocally, no doubt that patients are at risk here. Actual health care, patient services that they could be receiving are going to be compromised. There's no doubt. You cannot say that you're going to make cuts to physician services without affecting patient experience. And it's not just patient experience in terms of satisfaction. It's patient experience in terms of medical experience, what's actually happening to them. there's a few actual concrete examples that we can use. Do you want to get into that?
Yeah, sure. I mean, we see this sort of cause and effect relationship. So cause, unilateral cuts on addiction services, codes that doctors can use to provide care to patients who have addictions. That has been unilaterally imposed on us as of October 1st. And as of October 1st, we've actually seen addictions clinics closing down around the province, hanging up their business, and just because financially and economically it doesn't work anymore to service patients here. Those doctors may be doing other things, or they may be actually moving on to different provinces.
See, and this is exactly my point, right? Is that if you make cuts to physician services, you have to look at it from a very consequentialism perspective. You have to look at what's going to happen. And the trouble is with the provincial government is their consequential view is that it's going to help fix the budget. Mm-hmm. But they're neglecting what's actually happening to patients. So, I mean, this is a perfect example. If you cut addiction services, and it actually has nothing to do with that physician's salary. It has to do with the economical model that they have in place to have those clinics run. I mean, that's very simple. Yeah. That's economics 101. And what's happening as a result is that they close. Now, you're talking about cause and effect.
Yeah.
You close a clinic, what are you going to do? Where's that patient going to go?
That's right.
If anywhere, right, Mike?
Uh-huh. I agree. Any other specific examples you can think of?
Another great one is the scrotal ultrasound.
Yeah.
So there was, and you and I had talked about this on one of the podcasts, is that so there is an ultrasound that you can do, which is a diagnostic imaging test, to see if there's something like testicular cancer, or in certain emergencies, things like testicular torsion. And these are things that absolutely need to be dealt with. But what happened was the Liberal government said, we are going to reduce the fee that physicians reading these ultrasounds and interpreting them can bill. And it went to $6.
Literally $6, yeah.
And that was a tipping point. It wasn't just taking a little bit from physician compensation. Yeah. That was an actual economical tipping point, to the point where multiple ultrasonography locations were not doing scrotal ultrasounds. And the best, actually, if I'm not mistaken, I think it was Dr. Darren Cargill who was saying, so what do we expect? And you say cause and effect. Is the effect that testicles are just going to die? Mm-hmm. And we're not going to do anything about it?
That's right.
And that's a very, very short-sighted view. Right?
And it's my understanding that cut in particular, along with pretty much all of the other cuts, have been done without really any evidence to guide them. In that sense, they're quite arbitrary.
Yeah.
I think that's the frustrating part for us, isn't it?
So absolutely, and we were joking around on Twitter the other day. Well, I say joking around. We weren't joking. We were actually identifying major issues, and one of them was that who is actually providing the evidence, and we'll put that in quotes, or the data to substantiate these cuts. And the response was, well, it's probably people looking at spreadsheets. It's probably people sitting at a desk in a cubicle in some head office in Ottawa or Toronto somewhere, and then sending an email to Dr. Eric Hoskins. And yeah, I mean, in that sense, there's no medical evidence, no hard scientific data to suggest that helps. And this is another big point, is that when you make physician service cuts, it's not all about dollars and cents. You have to look at outcomes. And I mean, if we want to analogize with heart failure, you cannot just treat heart failure with something like Lasix or furosemide. You have to understand what's disease modifying, what will make people live longer. And you get into things like spironolactone and beta blockers and ACEs and ARBs.
Yeah,
right?
For sure.
There's medical data, and then there's just symptomatic relief. And I think that's what the government is doing. Yeah,
that's an appropriate analogy. And we acknowledge, they have a budget, it's tight. We have a lot that we need to do in terms of, there's a lot of heavy costs in terms of providing a publicly funded healthcare system. And so we have to work within a budget. And I think everyone acknowledges that, physicians, patients, the ministry, and the government alike. The trouble is the way in which this is being addressed without negotiation and good faith with some of the major stakeholders in healthcare, which is physicians.
Correct.
And patients.
And if think about that, Mike. If if we want to look at, for example, you and I are family doctors, we want to look at primary care reform, which is not the first time that there has been primary care reform in this province. If we want to look at it again right now, how can you go about this without engaging the very doctors and patients that are experiencing primary care in the trenches? Mm-hmm. How can you sit in the back lines and just sort of peek over and say, do this and do that, and maybe that will work and maybe that will work? You know what I mean?
Yeah, I know what you mean. I mean, we can look back at history, because history teaches us a lot. And we know that, many years ago, there was a time where there was a major shortage of family physicians. Many, many patients without a family doc, which has its own consequences both on health and on the system. It drags on the system in other ways. And so at that time, the OMA actually sat down with the government, and this was a time when there was good negotiation and a good relationship, and were able to come up with primary care reform. Introduction of these family health teams and organizations where doctors could practice, where they could have other people helping out, and it actually drew, new grads to come into family medicine. Mm-hmm. It started to turn this sort of poorly operating system into a much better operating healthcare system. Now, my fear is that with these recent imposed cuts and lack of negotiations, we're going to go in the complete opposite way. Mm-hmm. And I fear that we will turn new grads away. In fact, 50 residency cuts positions haven't actually been cut. So that's 50 less doctors graduating a year in Ontario. And then the ones that do graduate from a residency position either will be without jobs or they'll have to move on somewhere else, somewhere where it's more attractive.
Absolutely. And let me pick up on a couple of things here that you said. There's one point I want to make is that when there was actually healthcare reform initially, and I think this was about 10 years ago, where we introduced things like family health organizations and family health teams, where we started to practice true interdisciplinary medicine. We actually started to provide services for people that weren't getting them. And what that looks like to the spreadsheeters is that it's driving up the cost of healthcare. Mm-hmm. But the truth, and this is where it takes not just an actual numerical perspective or an accounting perspective, but a bit more of a philosophical perspective, is that we're now providing services to people that were not getting them. Of course, if you create a system in which people have access, you're going to have utilization. If you have utilization, you will have increased costs. But those are services that were not being used before because these people were not getting proper care.
Yeah.
Okay. Now, the second point I wanted to pick up on, which I think is a huge point, is what's going to happen to new grads in this province. And right now, financial and economical things aside, there's you can make a whole argument with that.
Just based on that, yep.
What about the way that doctors are being treated in Ontario by the provincial government? It's hostile. Mm-hmm. Why would a physician want to come here when there's provinces to the west and to the east and states to the south that are actually actively seeking physicians from this province?
I've actually heard that people are getting recruitment letters from other provinces saying, we can use you here. We'd like your expertise here. And, so people are aware that this has become a much less attractive place for physicians to practice. It's very obvious, I think, to other provinces, and therefore they're trying to almost, in a sense, poach our doctors.
Absolutely. Yeah. So let's back up a moment, too, because this is another interesting way to look at it. I was doing this with a few residents. When you apply to medical school, right now in Ontario, it's actually one of the most competitive places to get in the entire continent. Mm-hmm. So, which means that you have to forfeit your preference of geographical location. So people are traveling to places that they don't necessarily have family ties.
Sure.
So I might go to Toronto, I don't have any family there. You might go to Western Ontario, you don't have any family there. And then the same sort of principle holds when you're going through a residency program. So there's very good reason to believe that many people that are finishing their medical school and their residency are actually doing so geographically somewhere where they don't have ties. So why are they going to stay?
Yeah.
What incentive do they have to stay?
That's right.
And I hope the government doesn't think that it's a friendly, collegial atmosphere that's going to make them stay, because that's the absolute opposite of the truth. And if you look to a neighboring province that says, our arms are open, come here. Did you hear about what's happening with PEI? Did you hear this?
No.
With so they're offering medical students. I might be a bit wrong on the numbers, but they're offering medical students something like $100,000 to pay off debt, or there's some sort of financial incentive to actually come out.
Yeah. Well, I mean, that's very important, because when you think about it, the average student has forfeited somewhere between 10 and 13, 14 years of their life after high school, has dedicated it to the study of medicine, and in the process has accumulated the average to something like $200,000 in debt. And now you come out, you're looking for a place to work, you have to pay lease rates, you have to pay staff, you may be looking into investing into a building, you have to buy all the equipment you see in an office. That's not cheap. And when you're doing that in the face of a lot of debt, unfortunately, the financial aspect of it is very important. And we need to be enticing doctors to want to, set up practice here.
Absolutely, and you want to, if you're the province of Ontario, you want to provide a excellent healthcare system to your voters and your citizens. You need to provide an excellent product. You need excellent doctors within it. Mm-hmm. I build on something you say. When I graduated from residency, and this is now what I tell students and I tell residents in family medicine, is that medicine before, blood pressure targets and the pathophysiology of disease and pathology and lab mark, all different things. It was this.
Yeah.
When you get into practice, that's the easy part. It shrinks. That's not the part that's so challenging anymore. But all of a sudden you have a fraction of the pie that's dedicated to human resources, administration, leases, building costs, miscellaneous, like costs for actually being able to practice in this province, all the fees and association fees. And when I say the pie, I'm not even necessarily, we're talking about, yes, the financial part, but also the mental currency part.
That's right.
A lot of the focus goes elsewhere other than medicine. Who is able to start and open up in a province where they have no infrastructure or support from the government?
Yeah, I think that's a major worry, and I think that's being overlooked big time.
Even when you start to look at things like orthopedic surgery, where are an orthopedic surgeon graduates after a minimum of 5 years in residency? They want to operate. These are people that love working in an operating room. These are people that love to actually surgically intervene. Where are they to go if they don't have ample operating room time and the government's not going to actually support their endeavors in that sense? I actually know several orthopedic surgeons who graduated that went south of the border to states that were actually opening their arms. Have you actually had friends or colleagues that have left the province as a result?
Yeah.
And what type of scenarios have you experienced or seen?
Family docs who don't have their roots tied down in any one particular place. They're happy to practice, in whatever situation is most supportive. I've had people go to BC, and I've had friends leave for that reason. Mm-hmm. Something attracted them somewhere else. And these are bright minds. These are people you want in your healthcare system providing the best of care. I think an important message is this. If we want good quality healthcare, we have to be willing to pay for it. Yeah. We can't have it both ways. And I'm not talking about specifically physician salaries, but like you alluded to, the population grows, we provide more access to the general public, there's less people without family docs. That will necessarily cause an increase in healthcare dollar expenditure. Yeah. So we have to make a decision. Is that something we want? Sure. And if it is something we want, how can we most efficiently use those dollars? So it shouldn't be about a global budget of spending. I think it should be more about, are we getting the care parameters we need based on each healthcare dollar that's spent? And that's where the negotiations need to take place. And that's where you need to engage people who can help point out, well, this part is a bit wasteful and we can cut there. This part is very, very necessary, the scrotal ultrasound. We should not cut there.
Correct.
So the question is that does social media, Twitter, Facebook, play a role in what's going on and how we sort of take charge of the current situation as physicians, patients, etc.? What do you think?
I would say yes. And the reason I would say yes is this. I think it gets out to a lot of younger individuals. I do not think it's effective for obviously the social media naive population, which is really a lot of people, not to generalize or stereotype, but perhaps a lot of the older generation.
Sure.
And the other thing is that because of social media, the doctors actually came together in a very strong group and formed a very strong collective bond.
A good example of that is there was a Facebook page that went up. I don't remember the name of it. Do you? Doctors?
Ontario MDs concerned about healthcare, something like that.
Yeah, exactly. That's the one, yeah. And within a day or two, thousands and thousands of physicians joined up, just like that. So that's a united front that we all feel. We all feel like we're supporting one another. Even if it's not resulting in any specific changes at that moment in time, by coming together, we feel a sense of unity and that we can work through this together.
Correct.
Which is very important.
And on the same token, when people come together in a group like that, they share stories, they vent, they debrief, they brief, they throw out ideas. And there's been a lot of times where people say, they'll put a post and say, I don't think this is necessarily the solution, but what do you guys think about this? Yeah. Well, that would work for this reason, that would work for this reason, it wouldn't work for here, etc. And I think, most of the people that are not on that Facebook page are people like my dad, right, who honestly don't even know how Facebook works, but he's still a very loyal doc and gets updates from us.
That's right.
So I do think in that regard, it does help the cause. I think social media absolutely does help the cause.
Agreed.
And, as we're rounding to a close here, Michael, I like a point that you make is that some of these individuals, doctors that we are training in Ontario are extremely bright individuals with great altruistic motives that would really help the patient population. And these are individuals that we want to keep. The whole healthcare system, we are here to serve patients, and we want patients to have a safe and effective opportunity to seek healthcare services in this province. So I think one of the final things that I'm going to say is that the province of Ontario puts out a healthcare system with the final goal of supporting patients and making sure, just like you said at the beginning, that patient care is paramount and the ultimate endpoint for what we're doing.
I agree. And at this time, I think we're all feeling the heat of the fire, and we hope that things will improve in the future. I'd like to be optimistic, but we need the involvement of both parties.
Awesome.
And I think that's a good place to leave it.
And thanks for taking this opportunity to prove that we're not roasting too bad, and this is just a visual pun. We actually touched the fire, and I guess we will end there, right?
Yes.
Thanks, Mike.
Thank you.